I'm Joseph Geller. I'm a PGY4 at the University of Miami, and today I'll be presenting on wearable device compliance after total knee arthroplasty. So wearable technology can provide us with at-home monitoring of our patients after surgery. Oh, it's not advancing there. Oh, sorry. All right. So we can use wearable technology to track our patients at home after they have surgery, allowing us to monitor their progress with regards to range of motion, step count, and other methods of activity. But prior research has suggested that social determinants of health may affect patients' ability to utilize this type of technology. And so the goal of this study was to evaluate the impact of social determinants of health on track patch wearable technology specifically with regards to compliance rates after total knee replacement. So what is track patch? Track patch is a device that we put on patients' legs after surgery. There's an adhesive that sticks to both the femur and to the tibia. It's outside the skin. Like I said before, it allows us to monitor patient range of motion, step counts, as well as things like local temperature. The device is then transmitted to the patient's smartphone so that they can track their own progress through a device, and they can also interact with the technology so they can elect to do different exercises or even tests so that they can kind of test themselves and push themselves with therapy. And then finally, the provider, the surgeon, is also able to see this information so that we can better track how our patients are doing even when they're not in clinic that day, and to give us a more objective evaluation of how they're doing. So like I said, we get continuous objective data from this, allowing us to establish recovery benchmarks, and I think more importantly, it helps us to identify patients who might be divergent from the norm, people who might be high risk, who might not have as high of step counts, might not have the same activity levels, or even worse range of motion after a knee replacement. So we collected demographic data that we know to be associated with certain social determinants of health, including, but not limited to, patient language, ethnicity, sex, BMI, age, and insurance status. And then we looked into whether or not patients were compliant with their track patch use. Were they wearing the device, and were they actively interacting with it and choosing to test themselves and conduct exercises? So if a patient was just wearing the device, we called that passive compliance, and we consider that as the patient is passively interacting with the device. They're wearing it, it's providing us data. And then active compliance was, are they directly interacting, are they doing tests, are they conducting exercises through the device and through the application on their mobile device. So we prospectively collected data on 188 patients. The majority were female, more than 100 patients. Most of them were between the ages of 60 and 80 years old. More than 3/4 of our patients were overweight with regards to BMI, with more than 50% being very overweight. The majority of our patients, not surprisingly here in Miami, were Hispanic or Latino. Approximately 60% identified English as their primary language, and about 22% had a prior diagnosis of diabetes. So then we took this demographic data and we ran it by the number of days that patients on average were actively or passively complying with their wearable technology utilization. And essentially we found no significant differences with regards to social determinants of health and demographic data with active or passive compliance using the track patch system. So if you look here, you can see that patients with Medicare versus other insurance, they didn't have any significant differences with regards to the number of days that the device was worn and with the active use and utilization of track patch. And this was the same based on ethnicity, language, sex, and also the prior variables that I talked about. Then I just want to show some data that shows how this is valuable to us and how we can use these systems so that we can better follow our patients and identify patients who are at risk and help us to treat them. So if you look at the top graph, that's for passive compliance. You can see that patients continue to passively wear the track patch device well into the second month post-operatively, whereas actively they peak more in the first month, and then slowly as they begin to improve, they interact with the device less and less. It also allows us to identify as a whole post-operative knee flexion, and as you can see here, it's increasing steadily over the first 2 months post-operatively before it kind of plateaus, and this gives us an average and a baseline of where we can expect patients to be in a normal range. It also allows us to track things like step count, And then finally, postoperative leg position. So I thought this was interesting. It tells us if patients are moving, how often they have their knee bent versus having the knee straight, and even at different levels of flexion here. And you can see that immediately after surgery, patients are much more likely to have their knee in a straight position. And over the first couple months postoperatively, they bend more, they move more, and they're much more active. So in conclusion, wearable technology such as TrackPatch allows both patients and physicians to effectively monitor patient recovery and to quickly identify patients at risk for complications in the postoperative period after a total knee replacement. On average, patients tend to demonstrate higher active compliance in the first month postoperatively, but they continue to passively wear and interact with the TrackPatch well into the second month after surgery, which allows us to continue to monitor them even if we're not seeing them in clinic every day. And then finally, we did not find any significant differences with regards to social determinants of health and TrackPatch utilization, suggesting that this does not affect patient active or passive utilization of wearable technology after knee replacement.